This patient was referred to me for endodontic treatment of tooth number 10. Virgin tooth. What happened? His dog with its head bumped into his tooth. Poor guy. And traumatized the tooth. So as you can see, huge periapical relucency. The other teeth were within normal limits to percussion, palpation, and cold, but tooth number 10 was the problem tooth. Take a look here. Look at the labial swelling. This poor guy, he was in so much pain before he saw me. Was, I guess, over the weekend or something. He had to go to the emergency room, and they did incision and drainage in the emergency room for him. And then finally he was able to get a hold of his dentist on Monday, I believe, and his dentist then referred him to me. But that's part that you can see that's where the doctors at the emergency room, the hospital, did the incision and drainage, and that gave him some relief. And here's the post-op. So we did this root canal in one appointment. So everything went beautifully, as you can see. I placed MTA in the apical half of the canal. I talked to the patient before we, of course, did the root canal. And I told him, I said, we can go ahead and do the root canal. But with this large of an abscess, we might have to do an apical. So we said, we're just going to approach this treated non-surgically first. Come back and see me in a few months after we do the root canal. If the infection, that periapical relucency is healed, then great. If not, then we need to do apical. So he agreed. So that's why I placed MTA here, because now if I need to do an apical in a few months, apical is so much easier. I just need to go in, clean this out, resect the root apical part, few millimeters right there, and I'm done. I already have MTA in the canal, so I don't have to retrofill with MTA. Everything went beautifully, as you can see. We temporized the tooth and referred the patient back to his dentist for the permanent restoration. He'll come back to see us, hopefully, in a few months, so we can take a PA and make sure that this is healing. I say hopefully because we schedule them, but they usually don't show up. They show up only if there is a problem. If there is no problem, no issues, usually they don't show up. So I hope this patient shows up, even though if there are no problems, so I can report